Hello, my name's Karen Nutkins. I'm a patient navigator for lung cancer and I've been doing my role now for 2.5 years. I worked in the respiratory centre and on a Tuesday I used to do the cancer clinics, and then when they decided to make a navigator to do cancer full-time, I decided to apply for the role. I didn't need any clinical skills, it was admin skills that I could bring to the role.
Since I started in the hospital 3 years ago now, we've introduced the lung cancer pathway coordinators with Karen, who has revolutionised my life, I have to say. She is the linchpin to the service. I don't think it's unfair to her to say that, because she coordinates their patient's pathway from the first time that they're referred to us by their doctors or by the other members of the team in the hospital, all the way through to the point of diagnosis and then on into their treatment. Without her, I think we would really lose track of not just what's happening to the patient during that journey, but also that human touch and that human contact that people really need through what is likely to be the worst time of their lives.
I book appointments all day long of people that are coming back. I book CT biopsies, ultrasound biopsies, and we also have a waiting list of people that we watch and wait, so we bring them in, we keep on top of that, we make sure they have their chest x-rays every 3 months. I prepare the clinics for the following days for the consultants.
Cancer is becoming more complicated. It's becoming more involved in what we do, which is great because it means we can treat people and cure people from cancer in a way that we never could do 10 years ago. But to allow that to happen, it means doing a lot more investigations, a lot more tests and a lot more treatments. And unless you've got somebody that has an oversight of all of those things, you can miss things, you can delay things, and people can then miss out on having the most appropriate treatments. So if there's one thing I would want everybody to take away is get themselves a Karen, get themselves a pathway coordinator.
I actually feel privileged to be in my role. When you actually get in touch with somebody and they're quite worried about coming in, being able to persuade them it's in their best interest to come in would be the better outcome from them. And even some people who are frightened about having a CT scan because they're claustrophobic, it's talking them through it. And once you actually know that they've come in and had it done, you just feel proud that you've managed to help that patient.